as you buy me some time. Thank you very much, Doctor. Please do make your statement.
Your Excellency, the President of Uganda, Your Excellency, the Vice President, all ministers present, and all of you dignitaries, ladies and gentlemen, especially people living with HIV who are here. My name is Dr. Stephen Watiti. I am here to make a statement on behalf of people living with HIV. We are about 1.4 million Ugandans, and I'm one of them. But we are happy that because of your leadership, Your Excellency, we have done a lot. We have done a lot. We have identified most of the people living with HIV in Uganda. Out of the 1.4 million people who are estimated to be living with HIV, 1.3 of us are on treatment. I myself have been on treatment for over 20 years, and although I had AIDS, suffered from cancer, from some of the very bad diseases, I'm now okay. I was dying at 47, I'm 70, and as you can see, I am very healthy. The environment that you created has helped us to do a lot, but we still have a challenge. We are told by Uganda AIDS Commission, and it's true, that there are over 1,000, about 1,000 Ugandans are infected with this disease every week. We want this to stop. It is not in our interest, as people living with HIV who are already infected, to have more people getting infected, because this jeopardizes our lives. We want all people who are already infected to be able to live healthy and age gracefully with HIV like I am, and die of old age eventually, not of AIDS. We would like to stop these deaths, especially among men, and infections which are happening among young girls and adolescent girls and young women. This should stop. We are therefore requesting that financing should be increased. We commend especially the development partners like PEPFAR, the Global Fund, and others who have supported us. But as the Baganda say, we pray that, Mr. President, you who is Nanyinumufu and your government increase financing. Second, many people, Ugandans, the over 1.4 million Ugandans, are experiencing stigma. If we call people to come and meet you, many of them will not come because of stigma. We know stigma is based on myths and misconceptions about this disease, and the only way we can help our people overcome this disease by giving them correct information consistently. We know the information, we know what to do to stop this disease, we know what to do to stop people dying from AIDS, but we need to remove the inequalities. We need to stop the new infection, we need to stop the deaths. As I come towards the end, we are appealing that schemes like the insurance scheme and even the AIDS Trust Fund, which has been spoken about for a long time, that they are operationalized, because we are finding challenges, especially if the donors reduce on their what. There are other things like, for example, laws which make life hard for us people living with HIV. There is a law which criminalizes transmission of HIV, but now science has shown that people like me and many Ugandans who are on ARVs and their viral load or amount of HIV in their blood is undetectable, they cannot transmit HIV. We are not the ones who are transmitting HIV because we are on treatment, and if we are on treatment, we shall not even die of AIDS. Your Excellency, as we finish, we are spent 20 years at the National Forum of People Living with HIV, where I have been the chairman, and we are trying to build a center where we should be like our home, where we shall be and start teaching Ugandans, one, how to stop new infections, and how not to die of this. We request for your support. We need about 2.5 billion shillings to build this center, and if you do it, Mr. President, I promise that I will spend the rest of my life at that center and teach Ugandans how to avoid dying of AIDS. As I finish, I want to request that you allow me 2 minutes. I speak to these people in Uganda. I come from Bale. but I can speak Luganda. So allow me to speak some Kaskongu Luganda to my friends in Rakai. Thank you, Your Excellency. Bandange, Uganda bandange Rakai balabusiza. Mwebale nnyo okuja mu bungi bwe muti amanya gange nze Dr. Stephen Watiti ndi musawo mutendeke naye ndi omu kwabo abalina akawuka akaleta mu Kenya. Mu 1999 nali mulwadde nnyo nga nina kansa na TB bakafuba nane mulalama naye nga bwe mundaba ndi mulamu kati sida obulwadde obwonna era amira ddagala lyange nimbira ku time kyenjagala namwe abaliwo naddala abo abamanyi nti mulina akawuka mulabeere nti mwewandiisa mumbire eddagala namwe abataba kwekebeza mugende mwekebeze leero tetwagala muntu yenna omulala afuna akawuka twagala kye bayita zero new infections noti tetwagala muntu mulala afuna akawuka ekyokubiri tetwagala mwe abakalina gwe nange abalina tufune obulwadde nga TB nga kansa n'obulala ne bukutuuta abantu bakyafa ekisembayo njagala tukole tuyige ebikwata ku siriimu tulebe kusosola abantu oba okwesosola ebyo bye bange bannange ne bazannyo olw'okumpuliriza mukama bawo omukisa. Like my friend, I also want to table our statement with your office, Mr. President. I know that you are busy, but one time you'll get time and look at it and remember us. This is my sister, Ndeka. He's from Rakai. He's come here to support me. Thank you very much.
Banaye ngaloza Dr. Watiti. Webale nyo webale dada Dr.
Nze prima ntanda yarwo Ndeka. His Excellency webale kuija, webale kutujanjaba, webale kutukunda. 2012 tukatwina omukoro nkogo wa World AIDS Day National Kasensero Landing Site wanyeta nakishikanje kato waturaganisa ekyo kwenda kutukolera nerizoba tinka kubonaga erizagwa abo mugisha tata Museveni nkirizanyijaho nkwizusa kurungi okikoleho kigwe ntanda yarwo Prima Ndeka.
Thank you very much. Ladies and gentlemen, those were the statements on behalf of the people living with HIV. That was Dr. Watiti. Dr. Watiti, thank you so much for representing people living with HIV and also addressing our people, including in our local language, for them to get tested, know their status, so that they, if they have the virus, can begin on treatment so that they stay longer as we continue to preach ending HIV here in Uganda by 2030. I want to take the pleasure of inviting the LC5 chairman who is going to speak very shortly. The LC5 chairman, Mr. Samuel Kagwa Sekamwa. Chairman, please take to the microphone. And Your Excellency, as he takes to the microphone, very shortly, you will receive resolutions from the National Youth Conference on HIV and AIDS. The adolescents and young people are represented. We will also get the progress on the Presidential Fast Track Initiative on ending AIDS as a public health threat in Uganda by 2030 from the Director General of the Uganda AIDS Commission. And also, we will get a testimony, Your Excellency, from a graduated member of the child-headed household. I want to now invite the LC5 chairman to make his statement.
Your Excellency, the President of the Republic of Uganda, Honorable Ministers, members of the Diplomatic Corps, members of Parliament, all district chairpersons present, the resident district commissioners present, the district executive committee members and speaker and honorable councillors, all chairpersons for boards of commissions, all chairpersons for local governments, cultural leaders, all invited guests, ladies and gentlemen. Your Excellency, you allow me, I'll add in vernacular because of the setup, as you may see, Your Excellency. This is my speech to Your Excellency. I'm Sekamo Kagwa Samuel, Chairperson, Rakai District. Your Excellency, on behalf of the people of Rakai District, and on behalf of the Council, and on behalf of religious leaders. You are most welcome to Rakai district. Before I proceed, allow me to request all district executive committee members, the RDC and her team, to stand up and wave to His Excellency. Thank you. Under the same spirit, I also welcome and thank all the event guests, together with the people of Rakai, for turning up in big numbers to commemorate the World AIDS Day here in Rakai district. We are most grateful, Your Excellency. Your Excellency, the district profile is in my speech book, which is given to your protocol. Your Excellency, Rakai district is located in the central region of Uganda, bordering with Kyotera, Rengo, Lyantonde, Kiruhura, and Isingiro districts. It also shares boundaries with the Republic of Tanzania on the south. Its headquarters are in Rakai Town Council, and it is 190 kilometers from Kampala. Rakai district covers a total land area of 1,528.3 square kilometers and is partly covered by water bodies, which include lakes Chijanebarora and Kachera. Also, swamps and wetlands are available. That is administrative setup, Your Excellency. Rakai district was gazetted in 1974 and is currently made up of 2 constituencies, that is, Buyamba and Kochi, 11 sub-counties, 8 town councils with 73 parishes and 446 villages. Your Excellency, the population of Rakai district is 302,126 people, of which 147,535 are males and 154,591 are females, according to the 2014 Population and Housing Census results. District HIV status. Your Excellency, AIDS in Uganda yalabibwako kasensero ku ntandikwa ku mbalama za Lake Victoria mu 1908. Kasensero ekiseera ekyo yali mu Kyotera, eri Kyotera kati naye yali mu Rakai district. Obulwadde buno bwakusanya abantu ba Rakai district. Era rates was as high as 12% by 2014, but now it stands at 4.8% according to the World PLHIV in Rakai. Economic livelihood of Rakai district. Your Excellency, at a glance, Rakai district okutwalira awamu balimi. Era sekta y'abalimi eri about 70% bibali mu bulimi. Era ebirime ebisinga okulimibwa emwanyi, kasooli, amatooke, ebijanjaalo, ebinyeebwa ne kasava, n'ente zirundibwa, mulimu n'embizi, n'endiga, n'enkoko. Naye for the moment, abantu bavudde mu kulima ebyokulya ne batandika okulima ebintu ebivaamu ensimbi. Ekyo kivudde, Your Excellency, ku magezi g'obadde gwa otuwa nga otulambika okulaba nti tetulima byakulya byokka byokka, naye tulime ebintu ebivaamu ssente tusobole okweyimirizaawo. The other activities include public service, health, education services, construction, fishing, mining, quarrying, bars, restaurants, transport, motorcycle repairs, financial institutions, among others. central government and district programs. Your Excellency, with your permission, allow me to thank the NRM government and you, Your Excellency, in particular, for all the government programs given to Rakai, which include, but not limited to the following: Parish Development Model. Your Excellency, we appreciate this initiative, which is aimed at improving household incomes of our people. The district has 73 circles, and each has so far received million shillings, 937 million shillings, and a total of shillings 7,877,640 revolving fund has been disbursed, giving a total disbursement of 99% to 8,243 beneficiaries district-wide. Shillings 74,789,224 is also being disbursed. Agricultural Cluster Development Project, SCDP. This has greatly improved production and productivity of agricultural produce at household level, value addition and group marketing, hence improved household income. The Presidential Initiative on Skilling Uganda. Your Excellency, awotandikirawo amatendekero abavubuka okubawa ekyokukola nga bafunye obukugu mirimu egy'enjawulo gye bayita ebyemikono naye nze gye mpita ate eby'emitwe. Masaka Industrial Hub, Central Region, so far twakaweerezaayo abaana 23 abawala n'abalenzi. Gurupu ey'okubiri y'abaana 25 abagenzeeyo era abali kati mu training mu courses zino eziri welding, tailoring, hairdressing and carpentry. And bakery, among other programs. We're also very grateful for this initiative for the youth. Works and technical services. With support from the central government, Your Excellency, through Uganda Road Fund and the Transport Rehabilitation Development Grant, 1 billion shillings was given to the district. And the district has identified roads in bad conditions, which are now being rehabilitated, including Kifamba Chibale Chalulangira, 28 kilometers, Ramagwa BST Rekaba Fumbira, 17 kilometers, Kagamba Bale Rentrege, 21 kilometers, Chibale Chizibantatamiche, 21 kilometers, and others. Though we are experiencing a lot of rains, the road network will improve soon. I thank you, Your Excellency, in this regard.
Chairman,
also
conclude.
Underwater, Buyamba Pipe Water Supply System, Rwanda Pipe Water System, we are fully completed and are being extended to some parts of Dwaniro and Rwanda sub-counties, so that clean water and safe water, of course, will be accessed by our people. Also, Your Excellency, Kibale Chifamba Water Project, funded by Africa Development Bank, is waiting for presidential approval. It is under the Ministry of Water, Southwest Mbarara branch. It is waiting your approval, Your Excellency, for it to take off. Your Excellency, regarding hydroelectric power supply, the district has benefited from the ongoing rural electrification program by the NRM government, and this has facilitated agro-processing, especially in the maize and coffee value chains, growth of small-scale industries such as welding and carpentry, saloons which provide employment to the youths. Ekintu kino kyetaaga nkiddemu mu lulimi olwaffe
ng'owumba chairman obudde.
Amasannyalaze gatuyambye nnyo okuteekawo small scale industries naddala ez'abafubuka. Education and sports sector. The NRM government has constructed the 40 secondary schools and primary schools in the district, which has improved the school learning environment. These schools include Kalibala Kamya Memorial City School in Rwamagwa, Sub-County, Kachera City School in Kachera Sub-County, Kifamba Secondary School, Kifamba Sub-County, Kiziba City School in Mweruka Town Council, Kibale Secondary School in Kibale Town Council, St. Bernard's Manya SS, Kifamba Sub-County, and Chabiwa Primary School. Your Excellency, all this has been achieved with support from the NRM government, and of course we have been having partners who have been helping us, Cotton Foundation and World Vision and other partners to achieve this objective. Under the health sector, Your Excellency, a number of achievements have been registered. They include some of the following: Health Center 2 to Health Center 3 in Kiziba Sub-County, now Mweruka Town Council. Kifamba Health Center 3 in Kifamba Sub-County. The construction of OPD at Kibanda Health Center 3, Kibanda Sub-County, and at Kibale Health Center 2 in Kibale Town Council. Construction of maternity ward at Chimuli Health Center 3. Also with support from Bama, we constructed a maternity ward at Rwamagwa Health Center 3 in Rwamagwa Town Council. Challenges, Your Excellency, not only has Rakai District supported you, but still supports you. And in the recent elections, NRM won almost 90% of all the district political leadership positions, from villages to district, including members of parliament, all NRM. Your Excellency, I wish to remind you of our constant request to help us tarmac the road from Lyantonde, Rwamagwa, Lumbugu to Rakai district, and subsequently from Rakai to Ntantamukini Singiro district. This road, if tarmacked, will greatly help to improve the social economic lives of the people of Rakai. Also request, Your Excellency, that Rakai Hospital be upgraded to a referral hospital due to the big catchment area and the increased population being served by the facility. Under the fisheries sector, a dangerous weed has been sighted on Lake Kijanebarora and Lake Kachera, referred to as Kariba weed and water hyacinth. Almost 43% of the lake has been covered, making fishing activities difficult, and this has greatly affected food security and household income of our people. We request for your intervention as Sabarwanyi. I also wish to request for the vehicle to enable me to move to monitor district activities and to mobilize our communities. Your Excellency, kankubulira mu kino mukama wange, Your Excellency, emmotoka gye ndimu yali ekutta omuliro, nawonera ku lugwanyu. Singa nali sitegekeddwa kubeera kada 6 ya nkwanzi, nandibadde kati yempewo ekazi engoyi. Your Excellency, nkusaba onziruukirire. NRM juu zaidi. Your Excellency, I wish to end my speech. The copy of my speech is your protocol staff. I thank you for God and my country.
Banaraka Engaloza Chairman, Mumuengalo. Thank you very much, Chairman. I want to request the next speakers, please be mindful of time, be mindful of the weather, and be mindful that our principal has many other activities, and we would like to make sure we get all the time he has with us for his statement on this very special day, on this World AIDS Day. So I want to request Ms. Rashida Nabweteme to come very quickly. I will also request the Director General of the Uganda AIDS Commission, Dr. Nelson, to get closer to Ms. Rashida. And thereafter, I will also request Mr. Robert Kagwa Semuyingo to get closer to that microphone so that all the three statements are made in the shortest time possible. Your Excellency, Ms. Rashida Nabweteme is speaking on behalf of the young people, and she will be speaking of the resolutions from the National Youth Conference on HIV and AIDS, adolescents and young people. Ms. Rashida.
Thank you so much. Your Excellency, the President of Uganda, the Vice President, the Honorable Ministers, the invited guests, thank you for coming. My name is Watiti Rashida, standing in for the adolescent and young people. I am a young people living with HIV and born with HIV. Your Excellency, here is my presentation on behalf of the young people. Aid memo for the adolescents and young people during the commemoration of the World AIDS Day 2023 at Rakai District Local Government on 1st December 2023. Your Excellency, Uganda is joining the rest of the world to commemorate World AIDS Day, this day of 1st December 2023. As part of this commemoration, the Ministry of Health, in collaboration with partners, organized a pre-World AIDS Day conference for adolescents and young people with an objective of capturing the voices of all adolescents and young people regarding how they can contribute meaningful to HIV/AIDS response at community level under the theme, Let Community Lead. With the adolescents and young people continue to bear the burden of challenges including but not limited to stigma and discrimination, gender-based violence, child marriage, teenage pregnancy, and unpaid care work responsibilities. Your Excellency, we also have limited access to HIV prevention information and education. These challenges have continuously increased the risk of HIV infection among us, the adolescents and young people, which possesses a big risk to our country given our demographic structures in this country. Your Excellency, we would like to thank the government through Ministry of Health and its partners for implemented tailored programs and interventions that have continuously lessened the impact of HIV among the adolescent girls and young women and young people, like the Young People and Adolescent Peer Supporters Model, the YAPS, Adolescent Girls and Young Women Program, among others. Your Excellency, as we take the final mile to end AIDS as a public health threat, we the young people ought to lead implementation of the HIV response. Adolescents and young people held a pre-World AIDS Day conference led by Ministry of Health with support with partners, and adolescents and young people made some resolutions, Your Excellency. We the young people do ask the government, development partners, implementing partners, civil society organizations, cultural and religious leaders to consider adolescent girls, young women and boys resolutions. Your Excellency, linking and inclusion with special emphasis networks of adolescent girls and young women and young people affected and living with HIV to government wealth creation projects like the parish development model and policies and budgets to curb adolescent girls and young women economic and education exclusion. Your Excellency, keep adolescent girls and young women in school to scale implementation of prevention interventions among adolescents and young people, including adolescent girls and young women, provide supportive legal and policy environments for uptake of prevention-related services, eliminate all forms of violence, including sexual gender-based violence, and put in place stringent laws to curb gender-based violence that exposes young people and especially girls to new HIV infections, early marriages, and teenage pregnancy. Eliminate all forms of stigma and discrimination faced by young people in various subpopulations. Eliminate all forms of social, cultural, and economic barriers to access to information and access to available services for young people. Provide adequate support towards implementation of sexuality education for in and out of school AYPs, adolescents and young people. Integrate HIV in sexual reproductive health with disabilities and other programs. Inclusion of young people with disabilities, for example, the blind and the deaf, in all programming. Meaningful engage young people in all spheres of program implementations. Your Excellence, addressing the existing inequalities in accessing quality education and health through making services affordable and easily accessible by all young people. Adolescent girls and young women urge government to facilitate choice in HIV prevention through accelerating the introduction and availability of recently researched and proven biomedical interventions. Your Excellence, with the young people, we resolve improve psychosocial support counseling through supporting the recruitment of peer-led counselors by the Ministry of Health. Government should consistently facilitate adolescent youth-friendly human resources and infrastructures at different levels of service delivery, for example, schools, healthy facilities, community, judiciary. Facilitating a multi-sectoral approach in HIV response through engaging key stakeholders like religious leaders, cultural leaders, local councils, and service providers in ending inequalities among adolescent girls and young women and boys. Intensify and strengthen male involvement strategies and interventions in the HIV response, particularly targeted toward engaging young men and boys. Strengthening follow-up and retention for children and adolescents living with HIV if we are to achieve the 39.5 as a country. We, Your Excellency, we the adolescents and young people of this great nation, commit to continue contributing to the country's HIV response by fighting both self and social stigma and strengthening peer-to-peer engagements. Your Excellency, we will also influence our fellow peers positively to take charge of their lives by abstaining, regularly testing, and using condoms. Your Excellency, thank you for this great moment. I remain Nawateme Rashida, the YAPS National Trainer, Minister of Health, the YAPS Coordinator, and Amakea Water Read Project, Mukono District, a young person living with HIV, ready to fight stigma and end HIV by 2030. Thank you so much.
Ladies and gentlemen, a big round of applause for Ms. Rashida Nabweteme. We want to thank you, Ms. Rashida, and now invite the Director General, Uganda AIDS Commission, Dr. Nelson Musoba, to make his statement and give us a progress on the Presidential Fast Track Initiative on ending AIDS as a public health threat in Uganda by 2030. Dr. Nelson.
Your Excellency, General Yoweri Kaguta Museveni, President of the Republic of Uganda, Your Excellency, the Vice President, Honorable Ministers, the representative of the UN Resident Coordinator, ambassadors and heads of missions, members of Parliament, representatives of development partners, religious leaders and cultural leaders, local government leaders, representatives of people living with HIV, all of you invited guests, ladies and gentlemen, our esteemed President and invited guests, today we gather here to commemorate the World AIDS Day. We stand united in reflection, recognition, and resolve. The national theme is Ending AIDS by 2030, Communities at the Center. It's a great honor, Your Excellency, to address you and the entire nation of Uganda on this significant occasion, marking a day of national and global solidarity in the fight against HIV and AIDS. Your Excellency, firstly, I would like to acknowledge the pivotal role of your leadership in successfully shaping Uganda's national response to the epidemic. Uganda has been a trailblazer in implementing successful prevention and awareness programs, which has served as a model for other nations. The government's commitment, the collaboration with donors has resulted into providing accessible and affordable antiretroviral treatment that has undoubtedly saved countless lives and demonstrated Uganda's dedication to the health and well-being of its citizens. Your Excellency, I'm now going to share progress made, just highlights of progress made over the last 12 months since we reported to you on the implementation of HIV and AIDS prevention strategies 1 year ago in Rukunjiri. On the 95, Your Excellency, which are the agreed UNAIDS targets to be met by 2025, what it means that 95% of people with HIV test and know their status, and 95 of those who are positive are enrolled on treatment, and 95 of those who start on treatment take their medication as they should to achieve viral suppression. On this indicator, Your Excellency, we are at 90, 94, 94. But Your Excellency, this target is by 2025. When we reported to you in Rukunjiri, we were at 89, 82, and 78. We had just come out of COVID. So it also points to the impact of COVID on us. So I trust that on this target, Your Excellency, the one remaining year, we shall come very close to achieving it, the 95, 95, 95 by 2025. Your Excellency, the other indicator that I would like to report progress on is new HIV infections. Your Excellency, by the end of December 2022, we usually, working with the data from Ministry of Health, we look at data for 1 year. We recorded 52,000 new infections. A slight reduction from, again, what we reported to you in Rukunjiri. In Rukunjiri, we told you that we had recorded 54,000 in the previous year. So we reduced by 2,000. We can do better because, as you've told us, we shouldn't have new infections at all. That is the target by 2030. So 52,000 is not good performance. But the other factor, Your Excellency, that the young person has been talking about, who just spoke before me, is that 35% of the 52,000 new infections are amongst young people, the unmarried ones, the adolescents, between the age of 15 and 24. It's largely, there are three main factors. It's a question of information. They don't have enough information. And a question of disparity in income. A number of them, you know, because of challenges, they are either being lured in early sexual activities when they shouldn't, and they get tempted to that. But Your Excellency, when we look at the last period of 10 years, this reduction has been 40%. Our target was 75% reduction in new HIV infections. We haven't achieved that, but we have a 40% reduction. The third indicator, and this may be the last around progress, and then I'll refer to the report, Your Excellency, is AIDS-related deaths. We track when people die, what have they died in relation to. Last year we told you we had a total of 17,000 deaths related to AIDS, and this year we found the same figure. But let me say something, Your Excellency, about this. We are looking at the data working with the Ministry of Health. We think that, like Dr. Watiti has just spoken, because people living with HIV are on treatment, they are living normal lives, it's likely that most of these deaths are deaths that are affecting the rest of the general population. So most likely they are dying of, diabetes, they are dying of cancer, because he's 70 and he's exposed to other risk factors. So we need to analyze, although we are saying these are AIDS-related deaths, we will work with our colleagues in UNAIDS and partners and say, so 17,000, no reduction. We seem to be at the same place, but it's not, some of them, yes, if you delay taking your treatment and you get opportunistic infections, those classically fit in the description of AIDS-related deaths. Your Excellency, the rest of the data is in the report that we've prepared, and one of the key areas that I would like to point to again is HIV prevalence by district. We've tried to analyze that for every district and also ART coverage, and we've shared both with yourself, but especially with leaders. But like you guided, we don't want the numbers to excite us, because you may have a prevalence of 1%, but if we don't address the question of new infections, that can go high, Your Excellency. Following your last guidance in Rukunjiri about confusing messages, the Uganda AIDS Commission, working with the National Message Clearing Committee, reviewed and revised the messages, and the Minister for Presidency has issued guidance at both national and local level, Your Excellency. And the leaders are using this. We are especially working with RDCs to make sure that these messages are put out and our people continue to be educated. The emphasis on education and awareness campaigns has contributed significantly to changing society attitudes, reducing stigma, encouraging people to speak out, as we've just seen today, and seek treatment. Uganda has become a beacon of hope in the global fight against HIV and AIDS, showcasing that with determination, collective effort, it is possible to make substantial strides even in the face of formidable challenges. Your Excellency, allow me to acknowledge efforts, beginning with Mama Janet MUSEVENI, the First Lady and also Minister of Education. She's also gone out of her way, and currently she carries out regional campaigns focusing on young people, especially young people in schools, about abstinence and ensuring that, they avoid sex risk behaviors. And as you will see, we have been partnering her and moving around, and we would like to request, in fact, we have lots of requests from the region saying, please come to our region, and we are looking at the resource envelope to see if we can expand this program and make it even bigger. Your Excellency, allow me also to extend my deepest appreciation to the Honorable Minister for Presidency, Honorable Babidi Emile Babalanda, who oversees directly the Uganda AIDS Commission. Thank you. She has provided unwavering support, together with her colleagues in Cabinet and Parliament, and which has been very crucial for us to steer this in the right direction. She has shown us commitment and her leadership, and we appreciate her that provides this continuity. Your Excellency, I also want to recognize the dedicated team at the Office of the President, led by Haji Yunus Kakande, our Permanent Secretary. The coordination efforts across government departments and agencies have been fundamental, and what Haji Kakande has done is to successfully link us to all permanent secretaries through the head of service, which has ensured that critical cross-cutting issues are taken off by the ministries, departments, and agencies. We now have guidance issued by Minister of Finance that every government department has to make HIV and AIDS part of their core planning and allocate resources to that. And I would like to acknowledge the Office of the President for that. Your Excellency, I also recognize the frontline warriors, the civil society organizations, and brave individuals like Watiti and the young person who has been speaking here, who are the face of the epidemic. Their resilience, their advocacy, their dedication to the cause has been instrumental in shaping public perceptions, reducing stigma, and driving community engagement. And I would like, Your Excellency, before you to reassure them that together we stand united with those who face daily challenges of HIV as we draw inspiration from their strength. Your Excellency, allow me also to extend our gratitude to the UN AIDS Country Office. We have a remarkable representative in the name of Miss Jacqueline Makoha. Miss Makoha leads a great team, our sister from Kenya. She plays a crucial role. They are the Secretariat for Donor Coordination, ensuring that the needed resources are made available, harnessed, and utilized. However, Your Excellency, as I say this, as we acknowledge our achievements, we must also confront some persistent challenges that lie ahead of us. For example, what you've been talking about, the availability and effectiveness of drugs appears to also create a complacency culture amongst some groups. So despite this progress, HIV appears to still pose a threat. There is stigma and discrimination. There are efforts that hindering reaching some of the population groups and the youth in particular, but we are continuing to make efforts. In conclusion, Your Excellency, I would like us to use this occasion to reaffirm our commitment to a future free of the burden of AIDS. Your Excellency, as you've always told us, let us remember the fight against HIV and AIDS is not a medical battle. It's a collective effort that requires engagement of every citizen. There's therefore need for support, for the political support, religious support, other societal leaders to continue to increase awareness, prevention messaging in an unrelenting manner. Your Excellency, your leadership has been instrumental to these successes so far, and we are looking forward to your continued guidance as we navigate the last miles. I say all this for God and my country. Your Excellency, one last request. My team requested me that they would like to have a photo opportunity with you. So if you grant that, I don't know at this point or later, His Excellency is guiding that let it be after the function. I thank you, Your Excellency.
Dr. Nelson, I have included it in the photos. Don't worry, you're safe. Thank you very much. Ladies and gentlemen, can we appreciate Dr. Nelson Musova? Give him a round of applause. We want to thank you for the scorecard, Dr. Nelson. Clearly, we've made some milestones, and we appreciate the work of the Uganda AIDS Commission, but there is still work to be done, and we want to appreciate your team for the job well done, and we will continue to support you in these efforts. Your Excellency, we now want to listen to the community, a testimony from a graduated member of the child-headed household, Mr. Robert Kagwa. Robert, if you could make it to the microphone. Robert Kagwa Semuyindo, if you can make it to the microphone. I had seen him initially. He was one of our very first delegates here this morning. Robert, Your Excellency, is a member of a child-headed household and has graduated from that group of people, and this is where he's at this moment. Robert.
Tata President, tukwaniriza abagenyi baffe abakulu bonna tubaniriza mu district yaffe ya Rakai. Amanya nze Semingo Robert Kagwa. Nzaliwa ku kyalo Kasabukengere mu Ggombole n'ebyakabanda naye nga mpangalira mu tawuni ya Rakai nga nsangibwa ku ddwaliro e Rakai. Nze nazaalibwa n'obulwadde, nazaalibwa n'akawuka akaleta siriimu. Nze era we ntuukidde okuyimira wano nyina emyaka kati mpezezza 3 naye simanyi muzadde wange yenna bw'afaanana. Nakula n'abaŋŋanda n'abagadians bwe batyo abantu bangi abandeze. Taata mize eddagala ly'akawuka kano okumala emyaka 20. Emyaka 10 egyasooka nali muto byali wamu nga tebannamanya. Naye ne bankebera ne banzuula nti nyina akawuka. Byali si byangu mu community baatwalananga nga bakuvuma naye nga tolina musango. Naye nensalawo kaŋŋume kammira eddagala mu masomero nga tujeregebwa. Ne taata okuva lwe natandika okumira eddagala ne ntambula n'abasawo. Tukwebaza okubanga okoze kyamaanyi nnyo mu kulwanyisa akawuka ka siriimu mu ggwanga. Era taata nyongera okwebaza ekitongole ekya Uganda Cares, AHF Uganda Cares kikoze ky'amaanyi kindabiridde okuva mu buto kinjijajabye okuva mu buto mpaka nakati ne kimpa n'omulimo. Mbeebaza nnyo era bakama baffe we bali wano Country Program Director waali ne RMD Dr. Cecilia Guleta Masaka we bali Uganda Cares yonna weeri wano. Taata nyongera okukubiriza abavubuka abantu bonna bagende beekebeze. Inzo obulwadde nazaalibwa nabwo saabunoonya era nakitwala ne ŋŋamba bukome ku nze. Teri muwala yenna ali avuddeyo agambe nti Kagwa yansiiga obulwadde era tagenda kuvaayo. Eddagala ndimira bulungi. Teri muntu agenda kugamba nti Kagwa yansiiza obulwadde. Mbakubiriza bagende beekebeza akawuka ka siriimu. Bwe bakusanga mwekali ng'okayina bambi guma si gwe osoose ate giri emirembe twagivaamu egy'emabega. Mira eddagala obeere mulamu okolerera abaana. Bwe bakusanga akawuka tokayina weekuumire ku munno. Togenda nga weejajamya nti ate bankebedde ndi mulamu koonoonooze nooli. Weekuume obeere mulamu nga tolina kawuka. Bw'oba nako mira eddagala lyo bulungi. Taata Pulezidenti nyongera okwebaza abantu bano abanfudde kyendi okuba nga nsobola okuyimira mu maaso ne mbaako kye mbuulira abavubuka ku bikwatagana n'akawuka ka siriimu. Naliko naawe ku World AIDS Day yali ku landing site wali Kasensero. Nali muto naye nga nawa ka testimony. Nagenda nkuzibwa Madam Pulima abadde wano former mayor Rakai Town Council omu be banfominze okuba nga nsobola okuyimira n'enjogerako ku bintu ebikwatagana ne siriimu. Manager Laka, Mr. Kasozi Fred, Minister wa Kamuswaga nabo oyo muzadde wange bakoze ky'amaanyi okuba nga bamenta bange. Salongo Bikande owaawo awo ne Muzee Mutyaba ky'amaanyi. Taata nyina okusaba kwe njagala okutuusa eri gy'oli nga tulwanyisa akawuka ka siriimu okutuuka mu 2023. Omuntu agenda n'afa ku nnyimbe si kyabuwaze naye kyeyagalire. Omuntu agenda n'afa ne mumanya afudde siriimu naye kulumbe tolina kyowulako message yonna gye boogerako ekwatagana ku siriimu. Naye nga nandisabye singa mba nfudde famire yange nga tekigikosa kugamba nti Kagwa afudde kawuka ka siriimu. Bakyogereko abantu bakipiikinge bamanye nti gundi afudde naye afudde siriimu. Abantu kyongere okubawaako ekyokuyiga. Abo bakyagala si kyabuwaze. Okwo kusaba kwange singa kiba kisobose. Taata Pulezidenti tukwebaza okuba nga otukoledde buli kimu otujjanjabya amalwaliro eddagala gye liri, eddagala ly'akawuka gye liri. Mbakubiriza abalwadde tumire bulungi eddagala tubeere bakozi. Ate emirembe gino waliwo eŋŋombe egamba nti kati abalwadde ba siriimu bakozi okusinga n'abalamu. Ekyo mbongera okubakubiriza tubeere bakozi. Luli baali batya nina siriimu ŋŋenda kufa naye kati bwe bakkebera gwe kolerera abaana. Era taata ntera okukulaba kuno kusaba kwange ng'ogaba gy'oyiteeyo ng'ogaba ente ezivaamu amateeza ennungi. Taata nga naawe muzzukulu wo azaaliddwa n'obulwadde nsobola okulabirira ente eyo. Taata osobola okumpa ente eyo nevaamu amata nempeera n'abaana bange. Nyinayo abaana abo babiri. Nyina emyaka 3 nagamba owaaye n'afa sizaddeeko. Nyinayo abaana bange babiri. Taata osobola okumpaayo akati nekalunda nekaweerera abaana nekavaamu n'amata. Amannya nsigadde Semingo Robert Kagwa. Nebaza nnyo ekitongole kya Uganda Cares, AHF Uganda Cares.
Webale nnyo Kagwa. Bana ye engalo za Kagwa mumwongere ku ngalo. Ndowooza message mugibulidde bana Rakai and the rest of Uganda. Your Excellency, this World AIDS Day celebration here in Rakai district, Chibale Playground is live on Uganda Broadcasting Corporation, Your Excellency. And the rest of the country that isn't here with us is watching live the proceedings from Rakai. Your Excellency, just before I invite our next speaker, I wanted to recognize the following persons for your attention, Your Excellency, who are here with us and joined us to celebrate this World AIDS Day. The Ambassador of Ethiopia to Uganda is here. We want to welcome her. Can we give her a round of applause, ladies and gentlemen? We also have Her Excellency Latania Perez, the Ambassador of Cuba to Uganda. We want to welcome you, Your Excellency. We have the High Commission of Nigeria to Uganda, Your Excellency Abde Bowale. We want to thank you so much for joining us this afternoon. Your Excellency, we also have His Royal Highness Paul Sande, the King of Iteso. We have the Right Honorable Haji Idi Chwanuka, the Prime Minister of Kochi. We have the Right Honorable Stephen Chiinji, the Prime Minister of Toro Kingdom. And of course, our very own from the community who was mentioned here, Your Excellency, and later will be introduced to you, Mr. Jeff Dyke, the Director, Chivale Community Center, who is here representing the communities and the organizations that work with people living with HIV. Your Excellency, I want to take the pleasure, and we know we are running out of time, and I want to request the following speakers be mindful of time as we try and squeeze in all the speeches within the scheduled time. I will invite on behalf of the UN Resident Coordinator, Ms. Jackie Makoka, who is the Country Director of the UN AIDS, here representing the UN Resident Coordinator and all the AIDS development partners to come and make her address. Ladies and gentlemen, can we put our hands together for our dear partner, the UN AIDS?
Thank you very much. I do apologize for the time it has taken me to reach here. Your Excellency, the President of the Republic of Uganda, Honorable Vice President of the Republic of Uganda, Honorable Minister of the Presidency, Cabinet Ministers here today, Members of Parliament, government representatives, the district leadership, the board and leadership of the Uganda AIDS Commission, Your Excellencies, ambassadors, and heads of mission, religious leaders, people living with HIV, members of civil society working in the HIV sector, distinguished guests, ladies and gentlemen, all protocols observed. Please allow me to greet you kwa lugha ya Afrika Mashariki. Habari zenu, dada zangu na ndugu zangu. I'm reading this speech on behalf of the United Nations and the AIDS development partners. It is a great pleasure for me to be here at the World AIDS Day in Rakai. This particular district, Rakai, is important to the world and for us who work in HIV. It was the spotlight of the HIV disease in the early 1980s, when the communities started describing a disease that was causing people to get slim and die. It is this action of the community in coming forward to report this strange disease that led the world to start addressing HIV. And so for me, as we celebrate the community, it is important that we came to Rakai. On behalf of the United Nations and AIDS development partners, I would like to thank the people of Rakai for their actions very early in the 1980s and the actions that they are taking now that have contributed in controlling the spread of HIV. Your Excellency, Uganda has demonstrated to the world what can happen when you combine strong political leadership, good science, solid health systems, and a good community response to address epidemics. Uganda did it for HIV in the 1980s and is still working on that. You did it for COVID-19 and recently for Ebola. These are remarkable achievements and must be celebrated. We are only left with 7 years to achieve our commitment to end AIDS as a public health threat. Many of us already know where efforts must be directed, but allow me to highlight what we think is very important in the next few years. We've heard from the Director General of the Uganda AIDS Commission that we had 52,000 new infections last year, and that the bulk of these infections are happening in young girls and adolescent women, 15 to 24 years of age. Your Excellency, these are girls mostly who have fallen out of school. It is a cycle. They fall out of school, then they become victims of gender-based violence, sexual harassment. They end up getting pregnant, early pregnancy, and then they get married, and they also end up repeating the cycle and infecting their children. Last year, Your Excellency, we had 6,000 new infections among young babies who were just born. The bulk of these babies were born to girls 15 to 19 years old. They were exposed to HIV during pregnancy or breastfeeding. Your Excellency, Uganda has the tools, we have the political will, we have the systems, and we can stop this. It is important to also note that only 45% of girls who leave primary school transition to secondary school. And this is where we start having the problem. So to achieve a lasting impact for these girls, we need to ensure that they are supported to transition to secondary school and to complete their education. Also, Your Excellency, the Uganda AIDS Commission has told us that we have achieved 90-94-94 against the UN AIDS targets. Unfortunately, it's not for everyone. We are not achieving these targets for men and for children, for young people. Men and young people are likely to know very late that they are HIV positive. They are likely to fall out of treatment, and they are more likely to die of AIDS as compared to women. So this achievement is not for everyone, and we need to ensure that it is for everyone. It is very notable that the Ministry of Health recently launched the National Plan to End AIDS in Children by 2030. This is a step in the right direction, and development partners have committed to support the ministry and the Uganda AIDS Commission to ensure that we reach this goal. This World AIDS is more than a celebration of the achievements of communities. It is a call to action to enable and support communities in their leadership roles. We would like to see communities that have been enabled and that are included in the core HIV plans and programs, and in their formulation, budgeting, implementation, monitoring, and evaluation. Also, communities need to be fully and reliably funded to enable the required scale-up that we need to achieve the end of AIDS. Barriers to community leadership need to be removed, and an enabling regulatory environment created to ensure that communities and civil society can reach those even far in the community and those who are in the margins of society. Today, communities all over the world are leading the World AIDS Day celebrations and are shaping the events and tailoring the detailed calls to their specific needs. Also today, the United Nations Secretary General has reminded all of us that AIDS is beatable. It's possible to beat. And I would like to end by quoting him. Let's finish the job by supporting communities to end this scourge in their neighborhoods, in their countries, and around the world. Asanteni sana. Thank you.
Ladies and gentlemen, a big round of applause for the UNAIDS and the larger UN family who continue to support our efforts to end stigma and end HIV by 2030. Your Excellency, we are almost towards the end, and very shortly I will be inviting the Honorable Ministers to address you. And before that, I will also request that you allow us to recognize some key stakeholders who have supported the Uganda AIDS Commission in this journey, and that will be done before your address, Your Excellency. I want to now take the pleasure of inviting the Area Member of Parliament, the Member of Parliament for Kochi County, the Honorable Kasirabo Boaz, to come and address his people, but also welcome you to the constituency and give us a scorecard of the efforts within the community to end HIV.
Your Excellency, President wa Uganda, nsanyusa okulaba era nkwaniriza Kochi. Wane waffe tugamba nti Kamuswaga ayinde naye ne MUSEVENI ayinde nnyo. Weebale kutuddizaawo obwa Kamuswaga bwaffe. Amazima amatuufu, Your Excellency, ne bwe tunaayogera bingi bitya, abantu baagala kuwulira ddoboozi lyo. Kati sigenda kulandaga kwogera lulonda kambe, ngenda kuyita mu byangu otubuulire entanda. Nategese sipiiki yange chairman LC1 n'agyogera ne ngamba onandiddeko empanga, ate chairman LC5 bwe yazze naye n'agitaanya. Naye muzeeyi waliyo akantu kamu kenjagala okwogera ku speech ezo zombi. Lyekkubo lino eriva Rakai ne liyita entantamuki ne ligenda Isingiro okulikuba chorus. Muzeeyi buli wogenda bakusaba bingi era nze olimu nkusaasira, oba obijjukira oba bitya, nze ntya n'okwogera ebingi. Naye amazima amatuufu gali nti eryo ekkubo lyokka lye njagala okwogerako ku lw'abantu abali wano. Singa onookitukolera ojja kuba ogase Isingiro ku Rakai, ate n'eno mu Maserengeta ng'otaddeyo ekkubo erisobola okutuuka e Mutukula n'abava e Kasensero nga bakonekitinga wano bw'oba togenze Masaka, n'oyita ku luno oluddugavu n'ogendera ddala mpaka Mbalala. Akakalukako kubanga obwedda twogera boogera, bw'onootandika okwogera bw'oti teri ajja kwogera, era naawe ojja kikiriza nti tukuwagira. Naddala twagala kukwebaza mulira ab'emikwano, twagala kwebaza Yoweri Kaguta Museveni, Pulezidenti wa Uganda, ye yaleese omukolo guno wano. Nkyogera sikirumamu, amazima amatuufu. Abaseddekezi baadde bagambye nti Rakai waliyo obulwadde ng'omukolo bagutwale simanya awalala, naye mbu bagamba nti Pulezidenti yakubye emmeeza n'agamba oba gye buli oba tebuliyo ngenda Rakai. Kati eyo enduulu temala, leka tumwongere endala nti yo. Tugenda kukuwagira nga twekuuma obulwadde obuleeta mukenenya. Tugenda kukuwagira nga tuteekamu amaanyi mu parish development model. Tugenda kukuwagira nga tuteekamu amaanyi mu ssente z'emyoga ze watuwa tukole projekiti naawe ozirabeko. Ate tugenda kukuwagira ng'okomyewo 2026. Ninyenda kukwanjurira omuzaire wanje John Kasirabo niwe tata. Obunyija Kishozi okamumbuuza aruho aine emyaka 88 kandi nawatuura nakumbuuza yangira ngukunda abendeho n'agamba mugambeho omureebe akuterere jambo mbwe nani mushaba ngo ijaho akuterere jambo kandi mwebaze no kutureberera no kutwegesa okukunda no kuhagira. ekyo nkimaze ab'emikwano mu kiseera kino munzikirize enkome wano. Alo, Your Excellency, waliwo abantu bangi bampadde bwe bategedde nti ojja bampadde ebintu bingi. Abasinga obungi be baveterani abaazirwanako nga yali ayina kyayamba naddala mu kiseera kye wabeereramu mu nsiko. Nk'ekyokureeberaho akaalo omushira bakana mwetarwaka itema akabalya omuheekera wa bukanga. So akakora munonga kureeba ngu yakusyaho buyambi. Mbwenu bampereze baraha nyingi byona nabitomu naninshaba ngu sekuritara byakire tubaase kusya obubaka bwa president abantu batakanye kwatsa ngu nabi byambira. Banaye munzikirize enkomaawo nange simala budde. Tusanyusa okulaba Your Excellency tukusuubiza bingi nga naawe bw'otuwa ebingi weebale nnyo weebalire ddala.
Your Excellency the President, I had requested and I was trying to avoid the protocol team coming after me, but I had requested the Honorable Kasirabo to request you, and I now want to request you, Your Excellency. There were about 14 entertainment groups that had prepared to entertain you. We only want to request for one, just one, to entertain you. With your permission, Your Excellency. Thank you very much, Your Excellency. Jakusaba subi muje bampadde obuddakiika bubiri. Kati mugenda ku representing abali bonna abatagenda kutuyimbira. Mwebe basazeewo nti mutuyimbireko leero. Edakikezi?
NRM oye, Yellow Checkers, Greater Masaka oye, Foot Soldier oye, Banyisa Subi Mukele Jaya Tumalo, Abaza, Mukele Jaya Tumalo, Tweyase, MUSEVENI, what you have us. Abaza watuyamba ssebo tweyanzisa minisita kasolo webale tweyanzisa Museveni watuyamba ssebo tweyanzisa sente z'ebyoga twazifuna tweyanzisa Museveni watuyamba ssebo tweyanzisa bidye mutulyeda tweyagala tweyanzisa webale kasolo webale tweyanzisa emupisi namwe webale tweyanzisa Museveni watuyamba ssebo tweyanzisa kinyamata masuubi webale tweyanzisa Museveni watuyamba ssebo tweyanzisa emupika siramu tweyanzisa Museveni watuyamba ssebo tweyanzisa jabira obulungi bwenjagala tweyanzisa kisobaka watuyamba ssebo tweyanzisa bazire wapekoti tweyanzisa Museveni watuyamba ssebo tweyanzisa ayindeka muswaga waffe tweyanzisa Museveni watuyamba ssebo tweyanzisa ayindeka muswaga waffe.
Bana Rakai, bana ya basubi mbuba wengalo subi group. Your Excellency, we will now listen from the Ministry of Health, who spearhead the efforts in the fight against HIV. I want to take the pleasure of inviting the Minister of State for Primary Health Care in the Ministry of Health, the Honorable Margaret Mohanga, to come and read her statement on behalf of the Ministry of Health on this World AIDS Day. Ladies and gentlemen, Bana Yengaloza, Minister of Health, Minister Mumweku Ugalo.
Your Excellency, the President of the Republic of Uganda, Her Excellency, the Vice President, Honorable Ministers, Honorable Members of Parliament, Heads of diplomatic missions, development partners, UN agencies, all the local leaders, protocol observed. I'm glad to be here on this day, the first day of December 2023, to commemorate the World AIDS Day. We get together with a profound sense of reflection and remembrance of those citizens of the world who have lost their lives to AIDS. We also stand in solidarity with those living and affected by AIDS. It is also a day when we look back at our achievements and determine to confront the challenges before us in the response to the HIV and AIDS epidemic in Uganda. We embrace this year's theme as Ministry of Health, let communities lead. It emphasizes the role of communities in the fight against AIDS and calls for collective action to empower and support communities in this leadership. It's in communities that diseases, including HIV infections, occur. But it's also in communities where, with appropriate message, disease occurred can be interrupted and prevented. Approximately 1.4 million adults and children are living with HIV in this country. Adults aged about 15 years and older account for 93% of this burden, with 60% of them being female. But working together, we have registered remarkable progress. The detailed number or numbers have already been given to you and shared by a lot of other speakers, so I will not delve into it. In the implementation of our programs, we continue to prioritize primary HIV prevention interventions. In 2023, we intensified social behavior change communication programs. Working with partners, we have utilized multiple media channels to reach to the public with HIV prevention, care, and treatment messages. The key prevention methods have been explained, including our ABC+D messages. As part of the World AIDS Day, the Ministry of Health implemented a number of pre-World AIDS commemoration activities, which the young girl here has already mentioned, and so I'll not delve into that as well, due to time constraints. The prevention of mother-to-child HIV transmission remains a key priority for the Ministry of Health. In this program, we continue to focus on 4 critical prongs, which include primary HIV prevention among women of childbearing age and their partners, prevention of unwanted pregnancies among women living with HIV, HIV testing and enrollment of lifelong ART treatment for HIV-positive pregnant and breastfeeding women, and finally, care and support for women and their children and their partners. In 2023, HIV testing among pregnant and breastfeeding women remained about 95%, with ART enrollment among HIV-positive pregnant and breastfeeding women at 94%, and the viral load suppression of 92%, which is quite commendable progress. Among babies born to HIV-positive mothers, ART prophylaxis was initiated for 88% of the babies, and 81% of the babies received the first DNA PRC test within 2 months. We continue to strengthen programs and efforts to bring down this number to 0. Further strategies to end HIV among children were spelled out in the recently launched Global Alliance to End AIDS Among Children by 2030, with a focus towards elimination of mother-to-child transmission. Now, HIV care treatment program. As of September 2023, 93% of the people living with HIV knew their status, a crucial entry point for accessing care and treatment. In addition, 98% of adults living with HIV who were aware of their status were on antiretroviral therapy, which significantly improves their health and well-being. Additionally, 92.2% of adults on ART achieved the viral suppression. We estimate that 1.4 million out of 1.44 million people living with HIV are enrolled on treatment. This data indicate that with sustainable efforts, the country is on the steady path to achieve the UNAIDS targets of 95% of the people living with HIV, knowing their status, also at 95%, and enrolling for life-saving ART, also at 95% of those on ART, achieving viral suppression set for 2025. I'd like to express our heartfelt appreciation to our partners, including the United States government through PEPFAR, the Global Fund, the United Nations agencies like WHO, UNAIDS, UNICEF, UN Women, and UNFPA, and other bilateral and multilateral partners for their unwavering support to our programs. Thank you all for this dedication. We are eternally grateful to you, and together we shall achieve our goals of HIV-free Uganda. We appreciate the people of Uganda for supporting our health programs, and particularly our HIV prevention and interventions. We congratulate those who have stepped up to lead in the battle against HIV and AIDS in this country. I would also like to finally give my special appreciation to His Excellency, the President of the Republic of Uganda, General Yoweri Kaguta Museveni, for his remarkable leadership in the fight against HIV and AIDS. I want to thank everybody who has come here today. Thank you very much for your kind attention, for God and my country.
Thank you very much, Honorable Minister. Banaye abe Rakai, bana Rakai. Ba Minister mubawanga kungalo. Musimeko Minister. Thank you very much, Honorable Margaret Muhanga. Your Excellency, we have several representatives of various institutions that support the Ministry of Health and that support the Office of the President through the Uganda AIDS Commission in this journey as we continue to fight stigma and end AIDS by 2030. And among them, of course, is the U.S. government, and representing the U.S. ambassador here is Mr. Dennis Bwanika. And we want to appreciate the U.S. government for continuous support of the Uganda AIDS Commission and efforts to end AIDS by 2030 here in Uganda.